So what we're going to do for you, Hannah, today is pop you under the Skin Observe, which is really great because what it does, it maps out exactly what's going on underneath the skin.
Okay.
And you can actually see what I can see when we're under here. So don't be scared, it's absolutely fine. So it's going to take 6 images. So it will show us daylight, UV, woods, polarized, cross-polarized and parallel. So it sounds a little bit technical, but I'll explain everything when we have a look.
Okay.
And what it's going to show us is exactly what's going underneath the skin and what's on top of the skin as well. From that we can come up with a treatment plan which is best for yourself, and we can discuss your main concerns as well.
Okay, wow.
All right, so what we're going to do is pop you under here. I'm just going to pop your details on here, which the iPad is quite useful because all we do is connect it on, we save all your details. The iPad will cleverly save all of your images, and then at the end of your treatment plan what we do is we take another set of photographs, and it's really nice to see because then you can see your progression and we can see the before and after and the overlay, so it's really great. All right,
cool.
So if you don't mind, I'm going to pop your details in here very quickly. Perfect. So all I'm going to do is just connect this on here.
Ooh, that's clever.
And then literally I will see your skin here and it will take the 6 images. So it will flash 6 times. So if you can keep your head under there, that would be great. What we're going to need to do, you can keep your eyes open because there's a mirror in there, so you can see exactly what I can see. So it's quite nice to see. So definitely keep your eyes open. Whatever you feel comfortable with though. If you did want to close them, you can, because I'm going to show you afterwards. If you can just pin your hair back, that'll be lovely.
Do you have a curvy bit?
Brilliant.
There we go.
And then what we're going to do is perfect. That's lovely. And then just tuck that part behind. That's lovely. And obviously there's no makeup on the skin. We would have double cleansed the skin before we popped you under.
Okay.
Lovely. So I'm going to just turn this round, and you're going to just place your head in.
Okay.
And there's a little chin rest there, so you can just place your chin on there.
Okay.
That's great. Perfect. And if you can just move slightly to your left, just very slightly, that's perfect. And tilt your head back very slightly. That's great. Okay, so now we're going to take the 6 images. So just stay nice and still for me. That's 1, 2, 3, 4, 5, 6. That's great. Perfect. Okay, Hannah, you can pop your head out now.
Oh wow.
And that was it. That was a Skin Observe.
Okay,
yeah.
Easy.
So it's nice and quick, but now this is the really important part, and it's quite
this is
quite nice to see
how bad my skin is.
So here, what we're going to look at is the daylight. So what this means is how your skin looks in natural daylight. So if you was looking at your face in the mirror, this is what you'd see. So in terms of your main concerns, obviously you explained earlier that the pigmentation, maybe the veins, the redness you was a little bit concerned about. So here we can see that. So a little bit of red little mottling and a little bit of brown mottling on the skin, so possibly sun damage on the skin. And if you don't mind me pointing out here, just some little fine lines that are starting to establish on the skin here. So this is great, this is the daylight. So now I'm just going to move over to the cross-polarized picture. And what this picks up is in detail what's going on underneath. So where the vascular lesions are, so your red pigments, and where your brown pigments are, so where your sun damage is, and how deep it is. Okay. So it's not too deep at all, which is great. It's quite superficial. You can see it's just slightly mottling over the skin, so it's easier to treat. Okay. So that's fantastic. We can treat it, yeah?
Okay.
This is the parallel polarized picture. So you'll see here texture as well as the blemishes. So when we talk about texture, how the skin appears under light, so if there's bumps, if there's open pores, if there's fine lines, so these are the other skin conditions we can really address as well.
Okay.
So if we zoom in, sorry to zoom in, but if we zoom in, we can start with the upper part of the face, just a tiny few open pores here that we can really help smoothing out for you and really just refresh that area. And a little bit of open pores on the cheekbones here and across the nose here. And just those fine lines really, so we can really help to reduce those or improve those if that was a concern for you. So I think what's important with the Skin Observe is, even though sometimes a patient like yourself may come in for one concern, we like to talk about the overall health of the skin, because if the overall health of the skin is much better, you'll also get a much better response with our treatments.
Yeah, and I think that's because I've got quite dry skin. So yeah.
So we'll have a look at that when we come onto our UV and woods, because we can see if it's dehydrated or dry, because a lot of patients get confused with, oh, they feel that their skin is very dry, actually it's very, very dehydrated. So we'll have a look at that. So this is the true UV. And this is nothing to be ashamed of at all, because this is what everybody's skin looks like under UV light. And what this does, it picks up sun damage, so any pigmentation, any discoloration. So if you think from babies, we are in the pram, we could be walking with mum and dad, and we're exposed to UV exposure and things like that. So unfortunately, we have these little melanocytes that sit under the skin, and any exposure that we have, they leak and they just sit on the surface of the skin, and that causes those little sunspots. But we can treat those, it's great, and that's why
bad.
Not at all, not at all. It's very superficial, like I said, and when I mean superficial, it's just sitting on the top layer. It's not clumped together. Some patients have hormonal melasma or pigmentation, and again, that's why it's so important that we do the OBSERV, because we can see how deep it is under the skin and what treatment would be better for you. But for you, absolutely no problem at all. It's very superficial. It's just freckled over the face. In this picture, you can see, which is the Woods lamp, the dehydration. So you can see an overall sheen of like a violet kind of purpley colour. And what this shows us is that it's your skin is certainly dehydrated, so it's lacking water no matter how much water you drink. Our skin is the largest organ, but yet the last organ that gets water. So it's really important that we're putting topical ingredients, medicated grade, that really will deliver that to your skin topically and underneath the skin, so that we can feed it with nourishment and hydration. If you're not doing this, this is when those fine lines will start to establish a lot faster. So it's quite useful that we've seen this today.
Okay, good.
And this is the complexion analysis. So this will show us a detailed complexion analysis of everything all together. So obviously here, looking at this image, is just the blemishes and the sun damage for us. So you've got some brown pigments there and some red pigments. So we know that that's your main concern, so we're going to treat that for you, as well as focusing on the hydration, so that will reduce your fine lines, and particularly around the mouth, and really pick up those pigments to make your skin look clearer, fresher, more youthful, younger. And that's what we want to do. We don't want you to look like anybody else or different, because you've got a beautiful face. We just want to, if you don't mind me saying, we just want to remove and reduce that aging process, which comes from external factors or internal factors. And we can do that really nicely. And what we'll do after your treatment plan, Hannah, we'll get you back under here, and then we can literally do some overlays, and I'll show you how that works. So, for instance, if this was your daylight picture, we simply take another set of photographs, it saves your images, and then what we would do is we would get one side on this side and the other side here, and literally we can reveal new skin, old skin, and really detail and show the improvements and the achievements that we've got for you, and the goals that we set at consultation, just to ensure that you've received the result from your treatments.
Oh, fantastic.
So yes, that's your skin OBSERV. Yes, new skin.